Hello everyone and welcome to the Ecology Lab field safety video. When planning to do field work for any course or project, there are a number of risks to be aware of and prepared for before stepping outside. The first step to being safe in the field is educating yourself. If you identify the risks, then you will be able to mitigate them and stay safe.
Heat can be particularly significant in the spring and summer, and if you're not prepared for it, it can be very harmful to your health. Heat exhaustion and heat stroke can often occur after long exposure to high temperatures and are often accompanied by dehydration. There are two types of heat exhaustion: water and salt. If you have water exhaustion, you will likely feel thirsty, weak, and have a headache. If you have salt exhaustion, you will likely experience muscle cramps and dizziness. These types of heat exhaustion will lead to heat stroke if they are not recognized or treated properly. Some things you can do to prevent heat exhaustion and be prepared for exposure to high temperatures are drinking water often, even when you're not thirsty, wearing light, loose-fitting clothing, and light-colored clothing to keep your body as cool as possible, wearing a hat and applying sunscreen to protect yourself from the sun, limiting your exposure to the sun by staying in the shade when possible, and paying attention to the reported heat index on the weather forecast are great ways to mitigate potential risks. The heat index is a combination of air temperature and humidity, which gives an indication of how hot the weather will feel to your body.
Be aware of ticks when going outside. They are parasites that carry many diseases. Ticks land on their host and attach to them. They bite and burrow into the skin, transferring their disease. One major disease they carry is Lyme disease, which is debilitating to human body. It is very important to be aware of ticks because, as you can see in this photo, they can be as small as a poppy seed and are very difficult to spot. Ticks can get into your clothing and hair, and they will stay there. Generally, ticks begin to burrow into your skin after 24 hours of being on you, so it is critical that you get the ticks off of you as soon as possible. To prevent a tick bite, wear light colors so they are easily identifiable on your clothing. You can also wear a hat, long pants, a long-sleeve shirt, and closed-toed shoes. Also be sure to tuck your pants into your long socks to minimize exposed skin surfaces. You should avoid going into common areas where ticks live, such as bushy areas and tall grasses. Use bug repellent with 20 to 30% DEET, which is the chemical ingredient in bug sprays that repel insects. Also, after you are finished working in the field, you should do a full body examination for ticks because they can stick on your skin or clothing. Showering is one way to check for ticks because although the shower won't necessarily remove the ticks, it will give you a chance to check your body and clothing. Always check your clothing inside and out. If you do find ticks on your clothing, you should dry your clothes on high heat for at least 10 minutes to kill them.
For areas on your body that you may not be able to see with a mirror, feel along your skin for raised bumps. Always be sure to check all areas of your body, even when the parts that are difficult to see. Ticks tend to like warm areas such as between the toes, the back of the knees, groin, waist, elbows, armpits, back of your neck, behind your ears, and in your hair and hairline. In the case of being bitten by a tick, there are many precautions to take. If you're comfortable removing it yourself, do so promptly. Transmission of the Lyme disease agent usually requires the tick to be attached for over 24 hours. Remove the tick using fine-tipped tweezers. Grasp the tick's head as close to the skin as possible. Pull the tick straight out gently and firmly. Make sure you don't squeeze the tick to ensure the Lyme disease agent does not enter your body. You should also place the tick in a container with a screwed top and take it to a doctor or local health unit to be identified and find out if the tick carried the disease or not. Be sure to thoroughly cleanse the area of the bite as well. Some of the early symptoms of Lyme disease usually occur within 1 to 2 weeks after a tick bite has occurred, but it can be as early as 3 days or as long as a month. If you have been bitten by a tick and develop a fever, headache, muscle or joint pains, fatigue, or a skin rash, especially one that looks like a red bullseye, you should promptly seek medical advice. It is important to know when and where you were bitten, or your best guess at that information so you can tell your doctor. Not all patients with Lyme disease will develop the bullseye, so be aware of symptoms.
As well, mosquitoes are another insect to be aware of when going outdoors. They are midge-like flies that feed on blood and can also carry diseases. To prevent mosquito bites, wear light-colored clothing, cover up, and wear long-sleeve socks and pants. Avoid being near standing water, as these are common breeding grounds for mosquitoes and bugs, and wear bug spray. If you are bitten by a mosquito and develop the following symptoms, you should seek medical help. Fever, muscle weakness, stiff neck, confusion, severe headache, and sudden sensitivity to light could all be early symptoms of West Nile virus or any other serious illnesses. Wasps and bees can also be harmful when doing field work if you disturb them. If you get stung by a bee, remove the stinger if it is safe to do so, and scrape the area with your fingernail or tweezers. Similar to ticks, do not squeeze the stinger while removing it, as it can release more venom into your body. You should thoroughly cleanse the area of the skin with water and then ice if the sting site is very painful or itchy. And you can also talk to your pharmacist. Like any open wound area, keep it clean for 2 to 5 days to prevent infection. Many people have allergic reactions to wasp and bee stings. If you are allergic to or have a history of allergic reactions to various stings, call 911 right away after being stung. Symptoms of allergic reaction to stings include difficulty breathing, rapid heartbeat or pulse, tightness in the throat or difficulty speaking, dizziness, nausea, or loss of consciousness, and itchy, swelling, tingling, or red skin irritations.
Another risk when working in the field is poison ivy. Poison ivy is a plant that is coated in an oily resin, which causes itchy rashes on our skin. You can avoid poison ivy by knowing how to identify it and staying clear of it. Poison ivy will have 3 leaves. The bottom 2 leaves will be closer together, and the terminal leaf further up on the stem. You should also wear long sleeves and pants to the field, and always wash your hands after doing field work. If you by any chance touch poison ivy, your skin will be itchy and will later turn into an itchy, blistery rash. Scratching it or showering will make it worse and spread the rash, so avoid this as much as possible. You should thoroughly wash the infected spot with soap, water, and a washcloth, then apply rubbing alcohol and tape gauze over the area to help stop the spread until you can visit a doctor. Be aware of what clothing might have touched poison ivy and avoid touching it as well.
If you are ever stuck outside in a lightning storm, be sure to avoid places and objects that lightning is likely to strike. These include tall objects, small groupings of trees, and isolated objects like telephone poles and anything else metal. Ditch your backpack full of equipment and follow the 30-30 rule to gauge how close the lightning storm is to your location and when it is safe to return to your work. If there are less than 30 seconds between a flash of lightning and a thunder, do not resume activities until 30 minutes have elapsed from the last lightning and thunder. If you find yourself outside in a lightning storm, get to a building as soon as possible and stay indoors. If that is not an option, find the lowest lying area near you. Lightning seeks high ground like hilltops, so try and find low unexposed area. If you are with others, spread out 50 feet away from each other. Remove anything metal from yourself, including watches, jewelry, and belts.
If you are doing fieldwork around water, such as walking near a creek, be mindful of the water conditions. Is the creek fast flowing, murky, or deep? It may be less safe than you think. Banks can also be unstable if they are composed of clay, if they are wet, or if they are steep and eroding. Stay away from unsafe water conditions. Gathering data is not worth your safety.